BC's top doctor is recommending the province continue with its prescribed safer drug supply program following a comprehensive review.
This is an important program, and we can do better at maximizing the benefits of this.
But Dr. Bonnie Henry made a slew of recommendations on Thursday to improve benefits and minimize harms, including expanding the program by making it accessible to more people and offering more drug options.
Diacetylmorphine or heroin in various formulations and different formulations of fentanyl need to be available through a program that has oversight, and that when we have these new formulations, they're available in the type of formulation that people need, so smokable versions as well as injectable version.
Other proposed changes include retiring the term prescribed safer supply and using prescribed alternatives to the toxic supply instead, and expanding evaluation and monitoring, including greater emphasis on unintended consequences. The review admits that while there are promising results around safer supply, there isn't enough high-quality evidence to describe it as evidence-based. It also acknowledges that diversion, people selling or giving away their prescribed supply, is happening.
Diversion in and of itself isn't something we should think of as good or bad. Diversion is something we should think of as in terms of its unmet needs. So diversion happens because people's needs are not being met in other ways.
BC's Minister of Mental Health and Addictions, who requested the review, says while they're still looking at all the recommendations, some are already in the works, including changing the program name and reducing the risk of diversion.
We're just starting to see that there are some promising practices here with the current model that we need to explore, that we need to look at how we can improve. That is our focus right now, is to focus on improving the current model that we have.
BC's prescribed safer supply program began in 2020, the first province to offer it, and was expanded in 2021. The goal is to save lives by steering drug users away from the contaminated, unregulated supply. In 2023, there were more than 2,500 suspected unregulated toxic drug deaths, the highest ever recorded in a year.
This program, this policy, in its intent, is an important part of the spectrum of medical care that we are providing and that we need to continue to provide for people who use drugs in this province.
In Vancouver, Monica Gould, City News.